Our topic is too hot.
Maybe the topic is hot.
And people were dying because of it.
People were dying because when that emotion hits you, I had nowhere to go in COVID, and my clinic was open during COVID times.
We thought she's getting a heart attack. You cured her.
Polycystic ovarian disease.
Some of my friends in 30s, early 30s, they have diabetes.
That's the
And
reason
you see,
invitation
मुझे likes नहीं आया यार, मुझे views नहीं आया यार.
through side effects of vaccine.
बच्चा 1 साल का होता है, उसको हम बहुत सारे वैक्सीनेशन देते हैं.
72.
72.
Yeah, those are permanent damage.
And is why are you giving this vaccination to Sky? Stop it. So COVID was there.
That's the thing.
हेलो एवरीवन, वेलकम टू माय फर्स्ट एवर एपिसोड ऑफ मन की बात विद निखिल शर्मा, जहां पर हम करेंगे कुछ इंटरेस्टिंग बातें विद सम अमेजिंग पर्सनालिटीज. और ये एपिसोड बहुत ही खास होने वाला है बिकॉज आप जो कुछ भी सुनने वाले हो उस एपिसोड में, वो मैं और डॉक्टर आशर हम पिछले 5 सालों से बात कर रहे हैं. तो 5 सालों की कॉन्वर्सेशन इस कुछ घंटों के पॉडकास्ट में. फाइनली डॉक्टर, वी आर हियर.
Yes.
1 साल से बात कर रहे हैं
हाँ.
कि करना है एंड वी आर हियर.
Yeah, we wanted to do it in COVID, but then the topic was such hot that time. But then it took us
We
2-3
wanted to do
years.
in COVID, and then pregnancy happened, and then life happened.
Yeah.
I remember you telling me कि जब शानिस प्रेग्नेंट थी कि अभी लाइफ दौड़ेगा, और वो दौड़ा नहीं, वो तो सीधा मार्स में पहुंच गया. But then talking about Mars, I thought Nasik का weather would be like cold. You said it's going to be 7-8 degrees. मैं jacket लेके आया, but it's 20.
Yeah, Nikhil is too hot for Nasik.
No. Our topic is too hot.
Maybe the topic is hot, so the climate is also changing.
Yes. So how long we know each other?
It's 7 years.
I think 19, right?
Yeah.
19 end.
Yes. In fact, I know you since almost 12 years because I've been following you and your bikes and your trips, and I always wished I should do it, and I did it.
You have
So
done it.
Yeah. So I did the Leh trip with this BMW GS, and the idea of buying the BMW came from Debu and Happy,
Yes.
seeing their bikes, but that GSA was huge, so I went for GS 1200 and I started riding.
So,
You are my motivation.
thank you so much. You have changed my life, doctor. That's why we are doing this.
Each other's.
So tell me, which is your favorite destination and which is your favorite video, Mera Wala?
The one with Debu and everyone on your Tiger, you were doing Leh Ladakh.
Uh-huh.
That was one of the favorites.
And जो उनको मैं border में छोड़ने गया था.
Yes. And the Alaska one.
But now you don't ride much.
Somehow you made me more famous.
So somehow the business
Motivation.
is the business is
Motivation
growing.
was too much and I got busy. Nee, the other thing is after COVID, a lot of things got clear about how the people suffer and what I should do for them for a better survival. The picture got clear. People started trusting me because they had nowhere to go in COVID, and my clinic was open during COVID times. And we could treat a lot of patients from the police community to bureaucrats to patients. We never refused or we never just watched people dying. We were there in the field. We never use protection of a glass or a PPE kit or a mask. We were out there touching the patients during COVID, which nobody was trying to do because we knew the idea behind it is what exactly is causing the problem.
Sorry to cut you. We'll talk about COVID later.
Okay.
Because that is going to be a very interesting topic.
Yes.
And talking about COVID, so see, I've been very lucky in my life. मैं ज़्यादा hospitals और doctor के पास गया नहीं हूँ. So when I came to know you're a doctor, I thought, ठीक है, doctor मतलब एक dentist होता है, एक normal doctor होता है. But then during COVID, Shanice, my wife, उसको anxiety attack आया था. I remember. She thought she's getting a heart attack. Now, I don't know if it was an anxiety attack or a panic attack, but then somehow you cured her. Also the PCOD. So it was a PCOD or PCOS?
Polycystic ovarian disease and syndrome. S is syndrome and D is disease. She was having disease.
Okay, so I remember उस time जब हम लोग Google करते थे, we were talking to a lot of doctors and everyone, and वो सब बोलते थे it is not curable.
Yeah.
उसको ठीक नहीं कर सकते. And when you cured her PCOD, I remember so many girls was messaging Shanice कि कैसे हुआ, सच में हुआ कि नहीं.
Yeah.
So first we'll talk about the panic or anxiety attack, and then how did you cure the PCOD?
Yeah. So first part, the panic and anxiety attack. These panic and anxiety attack are nothing but a exaggeration of your own senses. So she being sensitive and she getting exposed to this, everybody has those small palpitations, anxiety, but she being sensitive experience those things in a higher threshold. Okay. And the normally it is a nervous system, the
But the
autonomous nerve.
heartbeat goes
Yeah,
up.
yes, the autonomous nervous system stimulates the heart, the digestion, your thinking, makes you impatient, and there is no proper rest. That parasympathetic nervous system never comes in to the play. So she's not well rested, and that scare and fright and these things happening again and again become a pattern. So that pattern is what I changed, calmed her with whatever case history, and I understood what were the sensitive parts which she gets exposed to, things which she exposed to. I counseled her on that these are nothing but just body's mechanism where they are trying to guide you that you should go slow, change, not get hyper, not think much, solve that thing. And the PCOD or polycystic ovarian disease. Now, this is very, very, very important. All girls who have polycystic ovarian disease have a particular thing which they are going through, which leads to PCOD.
Okay.
Now, that thing is loss conflict or fear of losing somebody. Okay.
Okay.
When that emotion hits you, and you have to take more decisions, you have to stand on feet, you have to take care of your life, you have to really take care of something which is coming up, there's nobody to help, stimulates the female's testosterone levels, increases the testosterone levels.
Okay.
And that loss conflict affects and causes injury to the ovaries. The ovaries start producing less estrogen, and that's how you lose your menses. And the cyst never goes because the thinking of that stress that I have to be on my feet, I have to take decisions. Oh, there's nobody who's supporting me. What if I lose all this thing? Keeps her going, and this all decision making is more of testosterone. Estrogen goes down, and PCOD comes, and that was her case.
But I think nowadays, I think most of the girls, उनको अपने पैरों पे खड़ा होना है.
And that's the reason PCOD is rising.
So whatever you described,
Yeah.
I mean, when you told Shanice is telling me, "Hi, yaar, you know, I always wanted to be the bread and butter winner in my family. I wanted to, you know, break that cycle, earn more money." But there's so many girls out there, and that's why you think it's happening.
Yeah, that's the reason PCOD is on rise. It was not that
But
much.
it happens to everybody who's like that, or
The person who's aware and is not unnecessarily stressed so much by all these thoughts won't get PCOD.
so family matters.
Yeah. A girl who is saying, I should have been boy, or in the family, the family people treat her as a boy.
That to happens so much.
Yes. And wish we had a boy.
Uh-huh.
That falls on the ears of the girls.
Okay.
And a boy would have taken care of my factory, my company. The girl, I don't know, wo to parai hai. All these talks which goes on the house hits the girl's mind. And then they wish that they were a boy. Or they feel that they should work hard and become like the boys. And that compromises the ovaries.
But for Shanice, she's still like that. She's still motivated. She wants to, you know, earn more money, work hard. She still wants to be that breadwinner from her family side. But now she's okay. So ऐसा क्या हुआ? You
Yeah.
convinced her कि वो PCOD गायब हो गया.
Yeah.
And talking about the anxiety, I mean, if anybody who's in young generation listening under 25, they will think it's normal. Because when she told me before, she was not very serious. When you told her about it, she was like, I don't believe it. यार, ये तो यार, I don't think it's that. I'm not even thinking about it. It's just happening. और वो इतना बोलती थी, and sometime while sitting behind on the bike, बोलती थी मुझे मेरा हार्ट बीट रेज हो रहा है शानिस, चेक माई हार्ट बीट, चेक माई ब्लड प्रेशर. तो घर में 3-4 ब्लड प्रेशर मॉनिटर आ गए थे उस चीज़ के वजह से. एंड व्हाट फिक्स्ड हर ऑफ कोर्स इज यू and our first daughter. Uske baad she became very calm, and of course she was taking your medicine also.
Yeah.
And PCOD, I mean, she's still like that. So what changed?
Yeah, this is iron rule what I'm talking about. Every disease first hits your psyche.
Mhm.
That becomes a pattern that affects the brain, and the brain centers which control that organ either go into a hyperwork
Mhm.
or go into a cell loss.
Oh.
That is programmed. That is completely programmed. Some go into cell loss, some go into a hyper. So some the organs which go into hyper mode, the cell multiply, and one which goes into cell loss, there is less function of that organ. So ovaries are less function of the organ. So with Shannon's or all the patients who have polycystic ovarian disease or had polycystic ovarian disease, those thoughts affected their psyche, affected the brain and changed the organ.
So it's the way you think. आप जैसा
Yes,
सोचते हो,
वैसा
आपका
बॉडी
माइंड वहीं पर आपको लेके जाता है.
एग्जैक्टली और उसी को ऑटो इम्यून डिसऑर्डर्स बोलते हैं वेयर द बॉडी ट्राइज टू कॉम्प्रोमाइज ऑन its own organ, and that's the reason you have to take medicine all your life. But if you change the way you think,
Yes.
that changes the functioning of the organ also.
So I remember when she had PCOD और उसको ये बोला गया था कि तुझे जिंदगी भर मेडिसिन पे रहना पड़ेगा.
The progesterone
That
and
is
estrogen.
such an headache to be on medicine for the rest of your life.
Yeah.
And talking about that, nowadays a lot of 40 plus people are having hypertension and diabetes.
Yes.
So females का तो हमने बात कर लिया, PCOD.
Yeah.
Of course 40 plus में females भी आती है, males भी आते हैं, but then we men have more responsibilities, you know, society को दिखाना है. We have to look good also in terms of we are making money. So I feel a lot of my friends who's younger and older, they are going through बहुत उनको hypertension, and I think not even 40 plus nowadays is happening in late 20s
Yeah.
because of social media.
Yeah.
आजकल सबको बेस्ट दिखना है, वेकेशन के लिए बेस्ट जाना है. But when you meet them, they have a lot of tension, hypertension, and some of my friends in 30s, early 30s, they have diabetes. And मैंने उनको कभी इतना शुगर खाते हुए नहीं देखा है. What are the reasons? Do you think it's something similar?
No, it's called as the lifestyle diseases, and food alone is not the factor. Many people eat bread, many people have sugar, but they don't get diabetes. So the real reason for hypertension is overwhelming negative stress load. So if you're not enjoying your work, if
Okay.
you're doing things against your wish and will, your mind is wants to do something else and your heart wants to do something else, is called negative stress load. It's like swimming against the current. When you do that, naturally heart has to pump more blood, because you are doing something which you don't intend to do. Naturally is going to cause more of blood circulation to every organ which is under stress, and that is the stress. So people who are not enjoying their job, who are being unnecessarily bullied or abused, and they are not interested, but they are doing it for their livelihood, they have no other thing to do. And that's the condition nowadays more
But
thriving.
it's so many people now.
That's the
And
reason
you see,
hypertension is there everywhere.
you see so many reels
Yeah.
that I'll talk about a reel कि जहाँ पर एक बंदा रो रहा है गाड़ी में
Huh.
और वो बोल रहा है कि you see all this social media dancers buying their luxury houses and cars and you are going for your 9 to 5 job and crying. उसमें million hearts है, thousands of comments and people are agreeing कि काश मैंने 2020 में टिकटॉक पे डांस कर दिया होता. And they somehow people used to love their job. Like I have my friends, they're still flying in a very good position. Sometimes they say कि काश छोड़ दिया होता, and they're making good money.
जब वो बोलते हैं ना काश छोड़ दिया होता is a negative stress load.
And they were very happy, they have everything.
Yeah. So now they are thinking the other way, that is going to affect their heart. And very close is diabetes. So this is overwhelming negative stress load. Diabetes is resistance conflict. Resisting me or resisting something. Oh my God, this boss every day tells me something and gives me a lot of pressure, but I cannot do, I'm helpless. I have to resist it. When you are resisting something, the brain commands the beta cells, which make the insulin, to drop their insulin secretion in the blood. When it drops, your sugar rises up. Why does the sugar rise? So that you get more energy to counter that resistance and negative stress load. So body is all the time trying to save you. So diseases are not diseases, they are survival mechanism. If you understand that survival mechanism and stay away from those things, you can reverse all those lifestyle
सो यू
diseases.
मीन टू से कि हम जो लाइफस्टाइल अभी जी रहे हैं
Hmm.
उसे जीने का भी एक तरीका होता है.
Enjoy it. Be happy about it. The day you start resisting, this is not, I don't like, but I have no other choice, I have to do it, you're gone.
Oh my God, this is going to be very tough things to do because nowadays every person, I'm not even say the every second person, everybody वो दुनिया के लिए जीता है, दुनिया के लिए करता है, and they are not happy
Yeah.
in their life.
Yeah. So
वो एक गाड़ी लेता है, उसकी ड्रीम कार थी, वो 2 महीना एंजॉय करता है, फिर वो बोर हो जाता है उससे. वो
so
ट्रैवल डेस्टिनेशन जाता है, जैसे कि कोई बहुत सारे लोग मिलते हैं जिनको लद्दाख जाना है, वो जाते हैं, खुश होते हैं, सोशल मीडिया पे डालते हैं और फिर बोलते हैं यार मुझे लाइक्स नहीं आया यार, मुझे व्यूज़ नहीं आया यार, सही जगह नहीं रही. मैं बोला तू वहाँ घूमने गया था कि यार व्यूज़ के लिए गया था, रील्स के लिए गया था. नाउअडेज पीपल आर ट्रैवलिंग फॉर रील्स आल्सो.
yes.
यू हर्ड ऑफ दैट?
Yeah. And then they fail, their dopamine goes down, they are more in adrenaline rush. And that's how adrenaline or a cortisol in the blood is naturally going to increase your hypertension, increase your sugar.
So you think it's gonna happen to younger generation in the future?
Yes, the more and more younger generation is going into stress load, negative stress load, who are resisting some things in their life which they are just not able to cope up with. It's like pushing a wall which they cannot, and they continue pushing it. Naturally, the body is going to make more sugar and energy to push the wall.
You always talk about one thing, whatever we think we become. So you need a history of that particular person. आपको उसकी हिस्ट्री जाननी है. अब वो हिस्ट्री 1 साल पुरानी, 2 साल पुरानी, 10 साल पुरानी, और हिस्ट्री से प्रेजेंट का क्या लेना देना.
Okay, I'll give you an understanding. Why do I take a history in homeopathy? And by the way, I combine German new medicine with homeopathy. Homeopathy is all about medicines. Those are diluted medicines which go into your system and repair the cells which are into problems. But German new medicine helps you understand the cause. So in the history, we find the cause. Just to give you an example.
बट कितनी पुरानी हिस्ट्री होनी चाहिए?
हाँ,
Because I remember you are telling me कि my mother is not giving you history.
Exactly.
So मेरी मॉम को ब्लड प्रेशर है and you are saying कि हमको कम कर सकते हैं. I need to know the history.
वो जो मिस्ट्री है ना, वो क्या है? आई कैन गिव यू एन एग्जाम्पल. आई गॉट अ चाइल्ड ऑफ नेफ्रोटिक सिंड्रोम. His kidneys were not working. The protein was 4+.
A child of how
A
many?
child of 7 years. So ये बच्चा आ गया, मून फेस, वाइसिलॉन पे था, स्टेरॉइड्स पे था, एंड द प्रोटीन वाज 4+. And the parents came because they did not wanted to continue the same medicines lifelong, and they wanted to save him. So they asked me, can you repair this permanently?
Okay.
So I said, yes.
The kidney damage.
The kidney damage. Now the history part comes.
7 साल के बच्चे से उसके पेरेंट्स की हिस्ट्री लोगो कि उसकी हिस्ट्री लोगो?
वही मैं बता रहा हूँ, वही एग्जैक्टली बता रहा हूँ. वो 7 साल का बच्चा ज्यादा क्या बोलेगा? So all those illnesses which come from beginning, a child suffering, we take the mother's history.
Okay.
Yeah. So the mother was neglected.
Okay.
She was abandoned. She was like a refugee in the house. The husband never used to help him. She was completely neglected and abandoned. So,
but that happens in
most
so
of
our
family. So the lady who during pregnancy feels is so much, the child inside is also feeling that.
So do you think it is to happen before also, like हमारी मम्मियों के साथ भी ये हुआ है?
हाँ, बट उन्होंने अगर उस चीज को अवेयरनेस लिया है, या वो उतने सेंसिटिव नहीं है और वो उनकी नीड नहीं है, तो वो नहीं अफेक्ट होते. सो व्हेन दिस चाइल्ड केम टू मी, आई आस्क्ड दिस. सो German new medicine says that.
What is German new medicine and homeopath? I think homeopath came from Germany, right?
Complete this and I will tell you. So this child, when came to us, we asked the mother all these things, and the mother say, yes, I was feeling abandoned and neglected. So kidneys, how beautifully the body works, I'll tell you. Kidney, it is said, when does the kidney get affected? When you feel fish out of water.
Okay.
How the fish feels when he's out of water. Tadapti hai. So the kidneys, now when you feel abandoned in this, they retain protein and water so that the person should not fall short of water.
Even when they're 7 year old.
Even if the seven, that's the psyche which has been affected because of the mother's feeling during the pregnancy.
During the
So
pregnancy.
the history is so important. Now she feels that, the child also feels that. The child goes and hugs father, mother. Slight neglect affects the child. So he is behaving the same way what mother behaved during pregnancy.
Oh my God.
So the history is so important. So when we get the same thing in the child and the mother, and we give our medicine and make the child understand, and also counsel the parents to give him more attention,
Mhm.
naturally the need of water, the fish out of water feeling, mellows down. The homeopathic medicine repairs the kidneys, the cells, and it's now 3 years. This child is off steroids,
Mhm.
not getting any cold cough, not no other infection. He has become slimmer because the water retention has gone. And now the best part is the mind also changed. The parents say now he does not want our attention. He goes out and plays. He takes care of itself. Even if we don't look at him, don't appreciate, it doesn't bother him.
Mhm.
So when we treat in homeopathy with Germany medicine, you don't treat only the pathology. The mind also changes.
Mhm.
That's the reason the psyche brain organ connection is maintained and health is maintained.
Okay.
Now, what about German new medicine? German new medicine was found by Dr. Hammer.
Okay.
He is a German oncologist who, with his son, was traveling in a yacht. The pirates attacked him. The son died. He was oncologist.
Mhm.
He had a hospital in Germany, Munich, and he was in grief. The mother was in shock, and in that shock, the wife used to tell him, "Oh, at this age, we should have had one more child.
Mhm.
Can we have one more child?" And
And they
this,
were old.
they were old,
Mhm.
and at this age, how can we have one child?
Mhm.
Was the stress which the doctor got.
Mhm.
And one fine day, after a week or so, he started feeling a swelling in the testis.
Mhm.
He wondered, why am I having a testis swelling? He went for a round in his hospital, found 2, 3 patients who had testis cancer
Mhm.
and they had a testis swelling, called them up and asked them, what happened before you got this? They all said they lost their child.
Mhm.
And at this age, they wanted a child because they did have one more child.
Mhm.
So the desire to have a child, when affects the psyche, it stimulates the brain and the testicular cell to make more sperms at
Oh.
that age. When that desire goes out of control, the cells proliferate and go out of control, and that is what leads to cell growth, multiplication. When he found out that, he started treating and taking history of all the patient in the hospital. Here is the history very important.
Okay.
What happened before the disease? If you find, you can reverse it.
Okay.
And he worked on it and he could reverse his problems, and he started treating so many patients by just connecting that brain psyche organ part and also taking
So
histories.
it is psychology.
It's psychology.
So अभी जो लोगों के साथ होता है when they're adults, so it all connects to when they were children.
Yeah, if they have gone, the mother has gone through a lot in
Uh,
the when the child was in the womb, the child usually has those problems
uh-huh.
which the mother has suffered.
But a lot of millennials who are in their late 30s, 40s, they have a lot of problems in their life. So do you think it connects to जब वो छोटे बच्चे थे?
Yeah. So if there are discords in the family,
Uh-huh.
nowadays skin problems.
Yes.
Children have atopic dermatitis and skin rashes and
Correct.
psoriasis.
Mhm.
Psoriasis, they just keep applying steroid, it never goes down.
Yes.
Why? Because there are fights in the house,
Mm.
there are discords between parents, there is no love atmosphere. The skin is the organ of love, touch, care, affection. If the emotion goes dry of that love, touch, care, of affection, the skin, the organ which is connected to that affection, also goes dry. And that dryness, if it multiplies, it goes into more skin problem and psoriasis. So all the atmosphere in the family, if not happy, if there is no love found by the child, if there are a lot of fights and discords, and the parents are fighting and abusing each other, not respecting, the child is watching. and the child mostly will get skin problems or cough, colds, and rhinitis because he gets annoyed and sting conflict, and getting fed up of that fights affects their nose and lungs and throat. And if there's no love, touch, care, affection, it affects their skin.
What you're describing, I think इंडिया में ज़्यादा करके घरों में होता है. And when I was talking about my mother, so my mother and my mother-in-law, and I think lot of ladies have a similar story. कि while they were pregnant, they have to serve their in-laws, खाना बनाना पड़ता था, झाड़ू पोछा मारना पड़ता था, एंड कंप्लेन करते थे, लड़का चाहिए, लड़की नहीं होनी चाहिए. अभी भी होता है, काफ़ी घरों में होता है. एंड बहुत स्ट्रेस करते थे हमारी मदर्स को. एंड मैंने जितने लोगों से भी सुना है, they all say the same thing, because whenever they want to complain to younger generations ladies, they say you have life is so easy for you, what are you complaining it for? हमको ये करना पड़ता था, हमको वो करना पड़ता, तुम्हारे लिए तो easy है. And I remember my father and so many people घर छोड़ दिया. My father also left house. ऐसे नहीं my grandmother was bad, she was amazing, but then he never wanted to live in a place where everyone shouting, and then he said, I want to raise my children in a quieter atmosphere. So he left.
Yeah.
So
That's the reason you all became so handsome and healthy. But initially the ladies considered these things as their duty.
correct. पहले.
And they used to take those responsibilities and duty and do it happily. Some resentments and reproaches, but not much. Now there is a lot of libertinism. Now they don't want to listen. Now they are not going to do the duties and this I will not do. They become rebellious.
Yes.
When there is libertinism and rebelliousness coming in, they are going into negative stress load. And that's the reason they are falling sick, or they're having PCOD, or they're having hypertension. Then
it is a very debatable discussion, because now who will do the job?
Yeah.
Right.
Exactly.
Some say women give comfort and men provide. अब यहाँ पर it's a big
thing. So if the daughter-in-law is strong and she's rebelling and there is a lot of libertinism, the mother-in-law suffers. And if the mother-in-law is strong and rebellious and strong, the daughter-in-law suffers. Anyway, somebody is going to suffer, but you have to identify that this is the reason behind my sickness and get out of it, or be aware of it and get yourself not getting affected by those emotions or that say of each other.
So the solution does not lie in yourself. The solution lies in the entire family.
Yes, but the solution also is with you. You should also make yourself strong and trying to identify what are the emotions behind my illness. If you learn and identify, you still can avoid getting sick.
Somebody is riding long distance. हाँ कैसे कर लेता है तू? मैं सोचता ही नहीं. ऐसे जेब में पैसा है, आईसेट में चलाता हूँ, जहाँ नींद आएगी रुक जाएंगे, मैं सोचता ही नहीं है, हो जाते हैं लंबे लंबे. So I think people think a lot and they stress their mind so much. मैं भी करता हूँ, I do for my work and I do stress, but then thanks to you, you came into my life at the right time. You guided me. So I was like, okay, Dr. Asha ने बोला stress नहीं लेना है, काम करना है, relax होके काम करना है. I have 2 daughters, 2 toddlers in the house.
Oh my God, I know them and they are,
my God,
so much full of energy.
Yeah, I have marks here because of my elder daughter. She loves me, and when I say I don't want to talk to you, scratch. I said, Dr. Asha ने बोला है, you cannot scream, you cannot shout. Okay, but I don't do this. Okay, then love her, and then she's okay. I saw some videos where parents need to, co-sleep with their children till they're 6. It's very important, and I started doing it, and I've seen a big change, especially in my elder daughter. बहुत बड़ा change देखा मैंने. And talking about my kids, now we'll come to the most interesting part of this video, which is, of course, my firstborn happened just after COVID. I got married during COVID only, and there's so many things happen in my life, and I'm pretty sure everybody's life during COVID. You remember when COVID की जब news आई थी शुरू में, there was this video from China they were playing, where people are just falling down, they're frothing, ऐसे तड़प रहे हैं, and TikTok था उस time. When it really happened, it was not like that. Do you think those videos were fake? And that's all in the internet now, that COVID was made up. What do you think? Was it made up? And we want to talk more about it now.
Yeah. So I don't know about those videos whether they were fake or real. Uh, there was a COVID virus which was mutated from influenza virus. It was stronger. The medicines were not available to cope up with those viruses. This is all truth, yes.
So COVID was there. And
But
was it killing people?
that's the thing.
Because
Now,
I remember, sorry to cut you, I remember there were so many deaths. We have seen in the videos, in the news channel, it was all over a feed. People used to get nervous. I remember मेरा एक friend है and he's a daredevil guy. He's like, अगर आप किसी का झगड़ा कर रहे हो, he will take a flight, come and he will like, कौन किया? I remember him shaking on the phone. भाई मैं मरने वाला हूँ. भाई मैं मरने वाला हूँ. क्या हुआ? भाई मुझे लगता है कोविड हो गया. और हम हंस रहे थे ना कुछ दिनों पहले. अभी मर रहे हैं सब. मुझे कोविड हो गया. मैं नहीं बचूंगा. ऑक्सीजन सिलेंडर का इसको फोन करके उसको फोन करके जुगाड़ हुआ. So what was that?
yeah, let's understand this. Let's understand this. And only this understanding is what gave me confidence during COVID, because I did not shut my clinic for one single
You
day.
did not shut your clinic. आपने मास्क नहीं पहना. आपने वो पूरा जो ड्रेस
PPE
थी वो
kit
नहीं
nahi
पहना.
pehna, and I was all out in the field.
And we wanted to do this that time. And you said अभी नहीं करते. प्रॉब्लम में बढ़ जाएंगे. Wait for few years.
Yes.
So what was the
So
whole
the
thing?
logic answer and understanding again comes from the understanding of German medicine. And yes, homeopathy was a boon to help people bring out of that fear. So every fear, death, fear, conflict, it is called. Death, fear, conflict. Whenever there is a death, fear, conflict, it injures your lungs.
Like मुझे कुछ होने वाला है.
मुझे कुछ होने वाला है, मैं मरने वाला हूँ, always injures your lungs because it affects the psyche.
Correct.
Then the brain commands the lung cells to proliferate, to make more new cell, because there is an injury coming because of that fear. Okay? So new cells come in, and those new cells naturally are going to increase the intake of oxygen. So you start feeling breathless. That feeling breathless was not something which was bad. It was the body required more oxygen because of that injury.
So
and
that's
new
the reason
cells.
oxygen level was going down.
Yes, oxygen levels were going down because of injury. So new cells were being developed, and those new cells were demanding more oxygen. Yeah. So that was the concept.
And people were dying because of that.
People were dying because they were admitted in the hospital, and there were two people here dying, and no doctor is helping, nothing is working on them. That fear that tomorrow I am also going to die was the fear. Oh my God, tomorrow I am also going to die. That injured the lungs.
So जो घर से देख रहा है वो भी.
And that created havoc. But what we did, we assured the patient. We went and checked him physically. We gave him medicine so that his psyche, brain, and organ becomes stronger to withstand these crises. And when we gave this medicine and assured nothing will happen to you, they all recovered. So it was the death fright conflict. So more than the COVID virus, the fear of dying was killing people the more. And then the mRNA vaccine, which was not completely tested, was introduced at a very early time. The vaccine itself caused many deaths because the virus, somebody who did not have COVID started getting COVID.
Okay.
And the death started coming in.
So all people had to do is be positive.
Be positive.
Not watch news channel. Do not watch your reels, TikTok, nothing. Just relax karo.
Yeah. So that fear and those videos what you are talking about were more lethal than the COVID virus.
So you can say that ki whatever we consume from our mouth, it shapes us, and whatever we consume from our eyes, it shapes us inside.
Yes. What you consume through your eyes, ears, what you do, and if you're getting affected by it, will affect your psyche and your body.
And further going into that topic, vaccinations. Now, vaccination that time was compulsory. People used to talk about it in every countries. It was mandatory in every countries and cities. बट उसको ऐसे बनाया था कि आपको लेना हो तो लो, लेकिन आप ऑफिस नहीं जा सकते, आप फ्लाइट में नहीं बैठ सकते. डू यू थिंक दोज वैक्सीनेशन, लाइक it's all in the internet, it's not my words, people say that it's causing people to fall sick and heart attacks will go further. What do you think? Do you think the vaccines was necessary?
Yeah. No, I cannot say that whether vaccine was necessary or not. What I think was people who took their first and second shots, some of those patients who were sensitive to the COVID virus, unnecessarily they were healthy. After taking vaccines, they fell sick. So the
Right.
vaccines, whenever you take a vaccine,
Mhm.
whether it is a COVID vaccine or you take any vaccine, a BCG vaccine, your body takes it as an antigen and
Mhm.
creates antibodies.
Okay.
But if you are sensitive to it, you get fever, you get reactions of those vaccines, means you are sensitive to that. So going ahead is we are just talking about the COVID vaccine now.
Uh-huh.
After
We'll talk about more vaccines.
yeah, so after COVID vaccines, many people had avascular necrosis. Okay,
Okay.
they had bone destructions. Yes, many patients who come to me have heart problems, heart complications which they are
Do
developing.
you think it relates to that?
Yeah, it relates to that. All these
And I think
things.
many countries have accepted that also.
Yes, but the panic was so much. The panic during COVID was so much that nobody had any other way. So
Mhm.
they were helpless. So they found this as the only path and they took
So do you
vaccines.
think I need to worry because I have taken vaccine, or anybody needs to worry कि भाई मैंने तो वैक्सीन ली है, कुछ
Yeah.
गलत तो नहीं हो जाएगा? Because when
Uh,
you told me about it, I told this to my friends and everybody. So that time though they were laughing it out.
the beauty about this is if you have taken a vaccine and nothing has happened for a year or two,
Mhm.
you are out of it. Your system has coped up.
Okay, so now we are in safe zone.
Yes, yes.
Okay.
So now you have to be careful. Don't go into for more vaccination unnecessary if it comes in future because your body learns how to survive. If you don't take stress or you don't hit your psyche, your body will not fall a prey to all these illnesses.
You know what amuses me,
हाँ,
डॉक्टर, दैट जब कोविड था, सो हम लोग को बोलते थे मास्क पहनो, लेकिन अभी जब AQI हाई है तो आई डोंट हियर फ्रॉम एनीबडी कि आप हो सके तो मास्क पहनो. उस टाइम हमें 500-500 रुपये, 200-200 रुपये फाइन मारे जा रहे थे.
हम तो
एंड
मास्क भी लेते थे 200 300
मास्क
रुपए
भी
का
मिलते ही नहीं थे, सैनिटाइजर्स नहीं मिलता था. सो डू यू थिंक जो हुआ,
हाँ
जैसा मतलब मास्क पहनो, सैनिटाइजर लो, ये करो, वो वाज इट नेसेसरी या फिर इसको टाला जा सकता था?
यस इसको टाला जा सकता था और ये कौन सी बात को लेके मैं ऑथेंटिकली बोल पा रहा हूँ क्या आई यूज्ड टू सी 150 200 300 पेशेंट्स दैट टाइम
Mhm.
we never used mask we never used any precautions we were just serving the patients
Mhm.
and the patients also developed confidence in us that nothing is going to happen means if you're mentally strong and you don't fear because that fear was the vulnerability which was making the lungs weaker.
Mhm.
So if there's somebody who was telling you don't worry, I'm going to give you medicines, nothing's going to happen, there was no death fear, the patient never got COVID, or even if he got COVID, it was on a very milder way. So if that could have been taught to patients that don't fear,
Mhm.
COVID cannot kill you if you
I've
be
seen videos like
strong.
that.
Yeah, if you be strong, that if would have been spread, the disaster would have been lesser.
But you know, I've seen it's like there used to be 10 videos, people talking about be careful, कुछ हो जाएगा, and then used to be one video, the doctor used to say, don't worry, relax, आप टेंशन मत लो, आप अपना रोजमर्रा का काम करो, एक्सरसाइज करो, अच्छा खाओ, कुछ नहीं होगा.
गलत चीजें लोग ज्यादा देखते हैं, अच्छी चीजें लोग कम फॉलो
अरे
करते
ह्यूमन माइंड, हम क्या करें, हम गलत चीजों की तरफ ही जाते
हैं.
हैं.
Yeah, your human mind is very important. If you can keep your mind stable, strong, not let things affect your sleep cycle, the circadian rhythm, and you eat healthy and live healthy, nothing, no disease can touch you.
Okay.
But if you just go overboard and use that organ more and more, naturally that organ is going to suffer, and then brain is going to help him either by making it bigger, which they call tumor, or causing less cell growth, making it weaker.
बट अभी हम जो लाइव जीते हैं डॉक्टर, वी वांट टू वॉच बिंज वॉच आवर एंटायर शो, वी वांट टू पार्टी लेट नाइट, एंड दिन में ट्रैफिक होती है, वी वांट टू गो फॉर अ ड्राइव लेट नाइट. एंड मैंने बहुत पहले सुना था फ्रॉम एन OTT प्लेटफॉर्म, आई डोंट वांट टू नेम इट, उसने बोला था कि तेरा कंपटीशन कौन है, हु इज योर कंपटीशन, इज अ कंपटीशन ब्लॉकबस्टर, इज अ कंपटीशन थिएटर, इज अ कंपटीशन TV shows. दैट OTT प्लेटफॉर्म सेड नो, आवर कंपटीशन इज स्लीप. एंड जब से OTT आया है तो लोगों का जो 10 बजे सोता था 12 बजे सो रहा है, जो 12 बजे सो रहा है वो 2 बजे सो रहा है, एंड कुछ लोग तो रात भर जाग के सुबह सुबह सो रहे हैं. आई नो सम ऑफ माई फ्रेंड्स जो रात को सो ही नहीं सकते, they only sleep at 7 and 6 and they are cool about it. There are 21-year-old of my friends जो 21 22 23 साल के हैं, and there are friends who are 40 plus, and there are some, our mutual friend Happy, he sleeps at 10, gets up at 7, goes to the gym, and he's absolutely fine.
Goes to the temple.
Goes to the temple, very important.
And that's the reason he's happy.
Yeah, that's the reason he's happy. Talking about it now, because the mind plays a trick and mind is everything. And you were talking about कि fit रहना चाहिए, healthy रहना चाहिए, सोना चाहिए, but then end में outcome ही दिखता है, और वो outcome है body. And nowadays people are not happy with their bodies. You know where I'm going with this.
Yes.
People want to lose weight.
Yes.
They want to lose weight as soon as possible, because now it's not Facebook anymore, it's not Orkut anymore, it's not Hi-Fi anymore. It's Instagram Reel, and Reel is not for only for content creators or actors, it is for normal people only. And there are bullyings. आप अगर डालते हो, and if you're not good looking, if you're fat, there are a lot of bullies out there. And God forbid अगर आप एक actor हो या content creator हो और थोड़ा भी पेट बाहर है आपका, there are bullies out there. So people want to be, I will not call it fit, they want to lose weight ASAP. So there is Monjaro and the second one? Ozempic. So my question is, do you think it is really bad? It is safe, like steroid? A lot of people are, it is a banned substance, but still people take it.
The bodybuilders.
It is no, nowadays I think Gen Zs are taking it. It's in all the gyms. एक सर्वे हुआ था जिसमें बोला था कि अगर आप जिम जाते हो तो अगर 10 लोगों में से 5 लोग स्टेरॉइड ले रहे हैं, इवन इफ दे आर नॉट रिप्ड बट दे आर टेकिंग स्टेरॉइड. इट इज दैट बैड सब्सटेंस. आपका ट्रेनर ही आपको दे रहा है, लेकिन वो आपका रिजल्ट बहुत मेहनत के बाद दिखाता है. बट Ozempic और Monjaro ठप दिखा रहा है. एंड देयर सो मेनी सेलिब्रिटीज, as in COVID, they were showing the videos of people dying. Here, they're showing people with a very beautiful body. So it is tempting. And now people are taking it. And I know few clinics, the doctors are being trained कि हम patients को Ozempic या Monjaro कैसे दें. What do you think? Where is it headed? और इसका end results क्या हो सकता है? Is it bad?
See, anything which you overuse it and abuse your body is bad. All these drugs which have come up were coming up because doctors wanted some good drug to reduce the sugar levels.
Okay.
They were found as an anti-diabetic medicine. But the people who were taking it found also their weight reducing. So a diabetic who's taking Ozempic or Monjaro will be a small quantity sales. But so many people are obese, so many people are body shaming. So the companies tried to make it as a drug to reduce weight.
So do you think it's a very strategized PR campaign?
Yes, that's the bad thing in it. And so if you are given this drug and you take 1 or 2 times and you reduce weight and leave it, the body is such made by God that it will survive and heal yourself. But if you continue taking it, even if you don't have diabetes and you're just taking it for weight loss, once you stop it, your body will again grow. So you have to keep taking it. That keep taking it is abuse to your body. And that's where it is harming your body. And because it is a latest drug, the side effects have not been studied for a longer period. We are coming with weird side effects, losing eyesight, losing control of bladder, losing control of stools. So people now are coming up with their side effects after taking it for a longer time. So, my dear friends, there is never a shortcut. Don't harm your body and put it into such situation that reversing it becomes a big problem. So, love your body, work hard, and if you want, you should be very particular about taking it for a very short time and then shifting to a proper lifestyle and workout and maintaining it. Your body will recover, but just don't continue
So
for
you
long.
can use it as a jump start.
Yes, you can.
Like एक proper hack है. That's why doctors are being trained for it.
Yeah, that's for people who really are desperately want to use it, but I would still advise not to take it if you're not a diabetic.
For example, long time back मुझे किसी ने बोला था कि will you take steroid? I said I will never take steroid. I don't want steroid. मैं क्या करूँगा बॉडी बना के? उसने बोला था what if you are being paid 2 crores and you have a 50 seconds shot with Hrithik Roshan and you have to be bare body. Now will you take it? I said now I will take it because it's a big deal.
It's big.
I will take it, but I will, of course, I will
Later on repair my body.
I will repair my body. I will make sure there's a doctor. My blood work is done. I will ऐसे ही नहीं ले लूँगा मैं कि बस Instagram reel बनानी है. Of course, stake is high.
Yeah, you're careful about it, and it has been prescribed by a physician. And that also, for if required, your sugars are very high and you have no other way, then. But again,
But
it's
again, chocolate is
diabetes.
addictive.
Yeah, but again, diabetes, find the cause, which is resistant conflict. Remove all those resistance from your life. Your sugar will anyhow go down. It's all here.
It's all yeah, but people are lazy. I think the lifestyle which we have, which humans have created
Yeah,
now.
they don't want to change.
So you see people, they are like, oh, Swiggy, Zomato is the best thing happened to India. Yes, it is a very good thing happened to India. But the OTT, the Swiggy, Zomato, it is the reels, it is taking your time, it is making you lazy. अगर आप अभी किसी को, it's like you telling a guy who's been chauffeur driven in a Mercedes कि यार तू मर्सिडीज के पीछे बैठ के एंजॉय नहीं कर पाएगा. एक काम कर, एक बाइक ले, बाइक खुद चला, गर्मी एक्सपीरियंस कर और घूम. वो बोलेगा पागल है क्या, मैं तो अपनी मर्सिडीज के पीछे बैठ के घूमूंगा. लेकिन तू एंजॉय नहीं करेगा. मैं एंजॉय करूंगा ना, कुछ एंजॉय नहीं करेगा. ये हो रहा है हमारी कंफर्टेबल लाइफस्टाइल के वजह से.
Yes, it is called sedentary lifestyle, and this sedentary lifestyle is behind every lifestyle disease.
So now talking about lifestyle, I will again shift your focus in vaccination.
Yeah.
And why I will tell you. So when my firstborn Sky was born, and of course you know, 1 साल जब बच्चा होता है, जिसको नहीं पता, जब बच्चा 1 साल का होता है उसको हम बहुत सारे वैक्सीनेशन देते हैं.
Oh my God.
I'm not wrong, 50 plus?
72, what is the list which I got yesterday? From
72.
Yeah, 72.
And it is expensive as hell. Like there are cheaper ones and there is expensive one.
No, the cheaper ones. So what is available in civil hospital and Red Cross?
And promote ऐसे करते हैं उसको कि ये painful है और ये painless है. And as a parent, you don't want to give pain to your children. So you'll go for that expensive one.
The painless deliveries are the worst deliveries because the child and the mother, the process of giving birth, the child has to go through that process of normal delivery. Then only he comes out with all that difficulty and realizes and goes through all that pain and is ready and strong to take the pain of the world.
I remember जब मैंने सारे, because of course everything was good, we didn't call you, we didn't consult, we were going. You saw in one of my videos that I'm taking Sky for vaccination. You called Shanice. Shanice, why are you giving this vaccination to Sky? Stop it. Call me. I want to know कितना vaccination दिया है. And then Shanice gave you the list and you were upset. ये क्यों दिया? Of course, not all the vaccination. You were said कि कुछ vaccination देने चाहिए.
So the polio vaccine, the MMR vaccine, the initially which we have taken vaccines, which were limited, is mandatory, is good. But now they have come up with so many vaccines. These continuous giving vaccines for every disease, which the child will never in his life suffer. Maybe 1 in 3,000, 1 in 5,000 he is going to suffer. You are injecting those viruses half dead viruses in the body is what not good, which I feel. And I am treating too many patients who have gone through side effects of vaccine, who are sensitive to vaccines, and those are permanent damages which have come up. So that's the reason I am just cautious. What we get as what vaccines we have taken are the mandatory ones. All these new vaccines which have come up, you should be very careful before taking them.
बट एज अ पेरेंट कि जो डॉक्टर बोलता है हमें लगता है वही करना है. अभी जब आपको पता है जब बच्चा होता है उसका ब्लड टेस्ट होता है उसका वैक्सीनेशन शॉट्स आता है एंड द फर्स्ट थिंग एवरीबडी आस्क वैक्सीनेशन हो गया कब है इसका वैक्सीनेशन दूसरा वैक्सीनेशन कब है एंड यू डोंट नो व्हाट टू डू. जो आपको बोला गया है अब वही करने लगते हो. सो व्हेन यू कॉल्ड अस एंड सेड कि ये सब वैक्सीनेशन नहीं देने, मी एंड शैनन वी हैड अ ब्रीफ डिस्कशन अबाउट इट कि क्या करना है, सुनना है डॉक्टर आशा का कि नहीं सुनना है. एंड आई वाज लाइक कि देख अभी उन्होंने जो कुछ भी बोला है हमें वो सब सही बोला है. राइट फ्रॉम 2021 टिल नाउ एवरीथिंग हैज़ हैपेंड एंड एवरीथिंग हैज़ हैपेंड राइट. सो सुनते हैं. बट जब इवाना हुई माई सेकेंड बॉर्न, डे वन यू कॉल्ड सेट अब मैं जो बोलूंगा वो ही देना और बाकी कुछ मत देना. एंड यू सी द डिफरेंस. We saw the difference and we were very skeptical.
Yeah.
I mean like we were Shani's like क्या करना है ये नहीं देना. I was like we need to listen to him. नहीं देते. And I don't know it is genetics or it is just second born, but we can clearly see the difference. I hope my elder daughter is not watching this video 10-15 years like Dada why did you do this to me? मुझे क्यों दिया? I hope ऐसा ना हो, but then I'm pretty sure I'll have a very good explanation. I will put you in front of her. And also, I remember when Ivana, my second born, was sick. And polio drops के लिए लोग घर पे आए थे. And I said, दे दो. Shanice said, wait. Let me call Dr. Asher. मतलब इसके लिए क्या Dr. Asher को कॉल करना है? He said polio के लिए देना है. And she called you. You said, मत दो. I want to know कि polio तो देना पड़ता है.
So you have to be very careful with children. If a child has fever, he has cough cold, his immunity is already compromised. Yeah, that time you're going to put some virus in the system is not good.
Okay.
Doctors also say when the child is sick, he is having fever, cough cold, that is not the right time to give vaccinations. That's the reason I told her, be cautious.
Okay.
Our child is sick, not doing well, don't put unnecessary another virus in the system.
So later on, you said कि अब बाद में पोलियो दे दे.
Yes, you can think of giving it later, or if the child is much better, healthier, and then you can go on. But you have already given the regular polio vaccines, so it's okay.
So how many times you have to give?
Yeah, that's in the chart.
Okay.
What the chart is, you have to follow.
So there's a lot of things we need to still learn.
Yeah.
मुझे लगता है कि चलो सीख लिया लेकिन then something new comes out. And then you open internet, कोई बोल रहा है ये गलत है वो गलत है, and then I call you give me a solution, ये करना है वो करना है. It is so hectic.
Yeah, it's hectic because you need to understand your body and your health. And once I do the case history, so I have histories of all your children. I have histories so I know the child and I know how much he can tolerate and what thing disturb him. According to that, I deal with every child or patient differently so that he should not get any unnecessary shocks, medicines, which he will not be able to cope up.
Shanice to trust your medicine blindly. Whenever
you.
Shanice is, Ivana is sick, having cold, because I think Ivana has my symptoms. कुछ भी dust
She
हुआ.
looks mostly like you only.
She looks like me, but I think only for certain. Even my elder daughter Sky used to look like me, but then now she completely looks like my mother and Shanice.
Yes.
And now my younger daughter is converting to look like Shanice, but they both like to party like Shanice. I'm a very boring person, boring dad, but both kids they like to party. So whenever there's a party, they want to sit and talk to adults.
So that's it, na? If you party, you will fall sick. If she does not party, she will fall
She'll
sick.
fall
So you should find your own ways.
Yeah, but it's a dust I'm talking about.
Yeah.
So whenever there is a dusty environment, so she has cold. Like Skylar has good resistance to cold. But whenever Ivana is having a running nose, where is Dr. Asher's emergency medicine? I want to give. So what is this emergency medicine? that medicine? It is based on the history.
Yeah, it's based on the history. It's based on how the immunity gets compromised due to some issues. So whenever they fall sick, I usually ask what had they eaten, what happened, what was the overall atmosphere in the house, or what happened which really irritated her and she did not like it, are all the factors which make children sick.
I remember one thing now while we were talking about this. Say if you're comfortable saying. Remember when Sky was born?
Uh,
I was in Canada. And you know what happened to Shanice that time, right? I don't know whether I have disclosed this in the video or no.
you
Her
have.
blood pressure was skyrocketed.
Yeah.
So जब doctors आए, she was sitting normally. They said, "Oh my God, with this blood pressure reading, patients तो wheelchair पे आते हैं. तू बैठ के बात कैसे कर रही है normally?" And बस डाल का टूटना था, कौवे का बैठना था. She got so scared,
Panicked.
panicked, and whatever medicine they are giving her, she's taking. And कमाल की बात है, all the results coming normal.
Normal.
उसको मैग्नीशियम दिया, her blood report came normal, everything, urine test, सब normal था. She said everything is good. And then you said कुछ तो दवाई दे रहे थे, मत लेना.
Mhm. Yeah.
So I don't remember the medicine name.
Yeah. So she was into overwhelming conflict,
Mhm.
and that overwhelming conflict was leading into essential hypertension, and that was the reason why her blood pressure was going up that time. So there is a diagnosis for this. They call it as postpartum or hypertension during pregnancy. But all these things happen because the patient somehow gets into a panic attack.
Mhm.
And that's the reason I asked you to immediately rush to a pharmacy in Canada and pick up that medicine. And that medicine worked and things went normal.
Yeah, things went normal in just 2 days.
Yeah.
So now I'll talk about doctor. बहुत सारे लोग आजकल कंप्लेंट करते हैं about acidity. अचानक बढ़ गया है. So you have a clinic in Mumbai, Nasik, and Dubai. So acidity, thyroid, and the muscle pain. I have a friend in Canada. After 2021, he was all normal. उनको neck का प्रॉब्लम हो गया, किसी को बैक प्रॉब्लम हो गया, किसी को लेग प्रॉब्लम हो गया, एंड देन एसिडिटी किसी का बहुत बढ़ गया. नो डाइट चेंज, नथिंग. इज इट? ये क्यों?
Let's divide this. Let's take stomach first. Stomach.
I also want to know the chart कि मुंबई में कितना, नासिक में कितना, because the AQI is very different.
Yeah, yeah.
And Dubai में कितना?
Yeah.
If you're okay with that.
Yeah. But then it's the amount of stress level. Mostly the stomach problems and gastritis and intestinal problems, usually people from metro cities who are in that rat race and are not able to swallow something, means I'm talking about emotions. So anything against her, somebody's wish, somebody has to adjust, or he has to swallow anger.
Yes.
Gulp down
Like
emotions
बॉस
and
सुना
anger.
रहे हैं,
And
जवाब नहीं दे सकते, बीवी सुना रही है, पति जवाब नहीं दे सकता.
yeah, so
whatever.
you swallow those emotions. Stomach is sensitive to a conflict called as territorial anger conflict.
Okay.
If there is lot of anger in the territory means the workplace, home, friends, everywhere there is irritability, anger, and there is no peace in the relationship, are the people who usually have stomach problems, because they swallow and gulp down those emotions and anger that really stimulates the vagus nerve to let the gut get affected, more of acid being secreted, leads to more acidity. So
Okay.
acidity and all these things does not happen only because of food, but the person who is all the time swallowing anger and emotion in the territory, which is called territory anger conflict, and then he has some bad food that triggers it and makes it more worse.
That's why I don't have acidity problem.
Yeah.
I think that's why Shanice was telling me, doctor was telling me the reason you don't have acidity problem because
I am
छोटा
happy.
सा भी issue होता है, you're angry. You're punching here, punching there, screaming. Of course, now I'm relaxed because of my two daughters.
So you have to be aware that unnecessary anger and emotions in your environment you should be away from, because that is going to kill your stomach. The thyroid, females nowadays, a lot of suffering from thyroid. It is called as the shock, the frontal fear shock. Oh my God. Oh my God. I cannot do anything. You feel powerless. You
Okay.
feel helpless.
Mm-hmm.
Husband is coming home and nothing, no work has been done, and I have to speed up my work. That speeding up and all that things which should be done faster and faster, and the pressure of performance is what is affecting thyroid. And now you see everybody has to perform, whether it's a housewife or whether it's a dominating husband coming in, or there is a performance or other project to be completed, and there is household responsibility and project is a stress. Whether I'll be able to complete it, whether I'll be fast enough, that affects the thyroid gland. And that's the reason the thyroid gland shrinks, the thyroid functions go down, and that's the reason people are suffering from hypothyroid, means the function of the thyroid goes down.
Mm-hmm.
The function of the thyroid is for digestion, immunity, proper heartbeats, energy. All these things go down. The people start putting on weight, then energy goes low, their sleep gets compromised, there is palpitation, is all thyroid symptoms.
It is reversible.
It is completely reversible if you stop taking that pressure of performance and take and do your work calm, and don't try to impress others by showing them how much fast you can do work. That's the main psyche reason behind it. And then we give homeopathic medicine and make the patient aware. Thyroid reverses.
So it is very important to believe also. This
Yeah.
is something wrong with me. Because
Yes.
I've seen thyroid patients like since 10 years they're on medication.
Yeah. All their life they
All
take
their
it.
life.
All their life, and nobody tells them this. That's the part.
But they need to
Our
believe also.
podcast should reach every person that diabetes, blood pressure, thyroid, acidity, all can be
Even
reversed.
diabetes.
Yeah, even diabetes. All can be reversed if you understand the cause behind it. And we are discussing the cause.
Correct.
Okay, there are 100 diseases, there are 100 causes. We cannot go on in this podcast to find every cause. But whatever we have discussed, if you follow that and you stay away from those situations, or rather make yourself ready to be strong and face these problems, and not find yourself in a helpless and powerless situation, you can reverse these diseases.
And what about the joint pain?
Joints,
Arthritis.
yes, very important. Now, I'll give you an example. Every menopause lady who has menopause, they say that your bones are getting weak and you need calcium,
Yes.
and they are put on calcium. But have we ever realized why after menopause the bone gets so weak? The reason is, after menopause, the female feels I am useless. I am now
They
not a
feel or
female.
subconsciously.
No, subconsciously. Or they feel, na, the husband, now I have got menopause. Now I will not look attractive. I will not be able to be a wife to and fulfill the needs of a wife to the husband. Is devaluation conflict.
They think like that.
They think like that.
Okay.
Normally, females feel after menopause that I am now useless. I will become less attractive, and my husband will not give me that amount of value and worth because I'm not going to look attractive. Is self-devaluation conflict. Self-devaluation conflict immediately goes and causes osteoporosis or osteolysis. That is, the bone becomes brittle.
Oh my God.
And that's the reason the calcium reduces. Those females who don't feel so, I have a menopause, no worries.
Like they go to the gym.
Yeah, husband
they're
still
buying
loves
good
them,
clothes.
and they start becoming attractive, and they don't get osteoporosis or osteolysis. So people who devalue themselves, they feel their worth is going down. Now they are not attractive and they cannot attract their male partners or husbands, are the people who get osteoporosis. So for example, if you get a chronic shoulder pain, if you get a chronic shoulder pain and you're getting lot of stiffness and the doctors have diagnosed frozen shoulder, I'll give you an example of a patient who came to me whose father was bedridden.
The moment you said shoulder, you see, my shoulder is like
crackling,
all feeling stressed.
Yeah. So this guy came to me and said, I have frozen shoulder. I've gone to physiotherapist. I've taken steroidal injections, nothing, painkillers, nothing is working, and the shoulder is very stiff. It was the right shoulder, right side belongs to your father, right side belongs to your partner and work, left side belongs to your children and mother.
Yeah, so left side. For me, left side.
Yeah, so that responsibility of Ivana and
And
Skyu.
earlier was mother.
Mother, yeah.
Mother is.
Okay. So naturally, when you have that thing in your mind, the responsibility of this person whose father was bedridden was too much. He had to work, provide bread and butter to the family, and the father was bedridden and he never used to listen. As soon as this guy left, the father used to go and eat sweets and everything and eat any food and call food from outside and used to get loose motions and used to dirty the bed. This guy had to work outside and also go home and take care of responsibility. So and now I'm fed up of this responsibility, and this father not listening was the stress.
Mhm.
When I identified that and made him just not get stressed about it and not sleep over it and gave medicines, the frozen shoulder disappeared.
Mhm.
So the same way, you sit with a support on your lower back.
Mhm.
You cannot sit on a stool for a long time. But
Correct.
mentally and emotionally, if you require more support from your family, from your husband, your father, and you're not getting that support, the mind is stressed. That mind will release cortisol and stress hormone and try to stiffen your lower back muscles. Naturally, the stiff muscles will ache and pain, and the stiff muscle will also reduce the gap between two vertebrae, and that's why you suffer from lower back pains. Back Lower back is all about support, the upper back is all about appreciation. If you're
Correct.
not appreciating, or the wife is not being appreciated by husband, or husband is not appreciated by the wife, and many other things, you feel that appreciation needed and not, you get upper back pain.
Mhm.
If you have to bend down your neck against the wish of a very dominating person in your family, and you have to look down and bend down all the time, that person is insulting you.
Mhm.
It is called as intellectual insult, devaluation. And you have to bend down your neck against your wish. We say man samman nahi mila, and all the time you're not getting that man samman. It's the neck
But
which
I
goes
have seen
stiff.
this happens to a lot of rich men also. And they're
Yeah.
very filthy
So
rich.
they are ego. They have that ego, and if in that ego somebody hurts them,
Mhm.
how can this person say this to me? The neck.
Wow. And I've seen lately a lot of people who are rich, talking about being rich, they are not happy nowadays all of a sudden. They have everything. They have a wonderful wife, children, they have all the money to buy a car. And I know the answer because you've already told me the answer. It relates to dopamine,
Yeah.
but they don't sleep in the night.
Yes. So all these things they buy and they get, and that stimulates dopamine and serotonin, and they are happy. But one level and stage comes that these things don't make them happy, because they are not happy and life becomes stagnant.
A lot of people don't believe this, when I tell somebody, like I've seen a lot of podcasts of very filthy rich people, and they always come to one conclusion: money is nothing. Money is just a tool.
Yes.
I have a yacht lying down, I have my Rolls Royce lying down, I have Rolexes, I just wear this. But then people in the comments are like, yeah, once you have the money, it's easy to say it. But then it's coming from billionaires who say it, ki, money is just a tool. They have tasted all the food. अभी घर का खाना ही अच्छा लग रहा है लोगों को.
Yeah, our mind is very powerful tool. If you can just understand your psyche and stay away from stress, and be happy, you'll always be healthy.
Mhm.
All other things can be had, but once the health is lost, it is lost, and it's directly connected to the psyche. Every part of our body has some function.
Mhm.
If that function is overdone, you land up into tumors and cancer. If it is less utilized, then you lose muscle, you lose the muscle mass, you lose the bones. So everything in balance is
Mhm.
important, and keep your mind happy and identify what is stressing you and stay away from it. Believe me, you can reverse most of your diseases on your own.
You just have to believe it. But I've seen a lot of people, especially the extremely young people and extremely old people, they refuse to believe it. Does that happen?
Yeah, it happens because it has been told to them that the body suffers because of some bacteria and virus. Yes, you can kill those bacteria and virus, but autoimmune, what is autoimmune? The concept itself is wrong. The body goes into survival mechanism. It will try to survive and keep you healthy. That survival mechanism has to change.
Mhm.
If you that survival mechanism is making you overuse that organ, naturally that organ is going to suffer.
So the conclusion is that women needs to shop more because they feel really happy. And now I know why. My wife, my mother, my mother-in-law, every woman around me, they want to shop. So that keeps them happy. And men just wants to relax.
Yeah.
आज कुछ नहीं करेंगे. आज आराम करेंगे. आज बाइक लेके घूमेंगे.
That's you.
Probably that's why it makes me very, very happy.
Yeah, and that's it.
I've realized that, the reason I started,
And touch wood, that keeps you healthy.
it keeps me very healthy. Like a lot of people, they say, Ki, how can you ride motorcycle for so long? I don't think about it. And the whole thing started.
Because I am also a rider, and why I take motivation from you. When you ride, you are meditating.
Yes.
You are meditating. You cannot think of anything else.
Cannot think of it.
You have to focus. The coordinations have to be used, and you are alert and meditating. This is meditation, and
Right.
that meditation is naturally going to make you healthy.
And I like to ride alone and drive alone. And I don't listen to music.
Uh,
So everybody asks me, "Ki, how can you not listen to music while driving? How can you not listen to music while you're riding?" I said, I don't need to. I'm out there. I'm looking at the tree. I'm looking at the people. I'm looking at the road. I'm enjoying the weather, hot or humid. Especially,
also, when you ride with your friends, you have that Sena connected.
yes,
If you're talking to your friends, it's like your gupshup in a cafe is
Cafe.
going on. It's on the bike,
it's on the bike.
and the scenes are changing.
For 8 hours, 9 hours, we have no idea what are we talking, but
Yeah.
it gives us ultimate happiness.
Yes.
And somehow now, after being a father, so father to father, I'll say ki when my father passed away, that's when it started. So before my father passed away, I was that boy who just wanted to buy a sports bike. मुझे स्पोर्ट्स बाइक लेनी है क्यों क्योंकि बूम बूम
Mhm.
धूम मूवी धूमची बाइक जब भी कोई जाती थी अगर किसी को 2004-5 में याद है कोई भी बाइक जाती थी करिश्मा ये धूमची बाइक गेली मुंबई में यही सुनने में धूमची बाइक तो nobody knew Hayabusa and all that so I wanted to buy a Hayabusa my mom was like wait buy a house I was like I want to buy a bike wait buy a house thanks to my mother I have a lot of houses but then when my father passed away the interest completely vanished in show off bikes, in a super bikes. My interest was like, आज मुझे घूमना है. Because my father wanted me to go to certain places. And I also went, I said, मैं flights में bike से जाऊँगा. Like to travel on a motorcycle 10 years, like 12 years back, 1,000 kilometers was like, it is impossible. कोई videos कुछ नहीं थे. And then when I did it, I was like, why it is giving me so peace, the peace part. And fast forward it to today. Now when I travel, it gives me ultimate peace. But then the thought that I'm a father now. My daughters are waiting for me and the voice video calls come and the voice notes come. Dada, where are you? We're looking for you because now my kid can talk. So that makes you numb that you want to go home. But then now, of course, after a certain practice, now I can leave. And they also understand because I make videos, so they watch me. And they're like, Dad, I like your motorcycle. Very beautiful motorcycle.
Wow.
So when I ride, it is like my elder daughter is saying, very beautiful motorcycle, very beautiful motorcycle. And it keeps me going. But the difference is in the attitude. Now I'm more calm.
Yeah.
Now I don't rush. I don't get irritated if somebody's rash driving. It's not the age, I would say.
No, it's not.
Because I've seen people who are 28, 29, they're fathers, they're very calm. Do you think it's the fatherhood?
Yeah, it's a fatherhood. The responsibility, then the experience that all these things does not help, and actually the adrenaline rush has gone down.
Completely gone down,
Yeah.
vanished.
Yes, so that's what is all about aging and experience. But I would always want to suggest all these youngsters and everyone that you have to learn to do things which make you happy, the right things.
Very important.
The right
Very
things.
important.
Yes. And Search
I
for,
think all the mothers, the wife should listen.
yes,
Very important.
and search for a job, things which make you happy. So it will not be a job. It will be just a journey of your life which you are walking on and you're happy,
Hmm.
will keep you healthy. This, if they do it, that can really solve all their problems, because that will also keep them disease free.
Correct.
Yeah.
I think that's the reason whenever I travel, I come back more energetic, more loving.
Yeah.
And I always tell Shana that, I don't want to leave you guys. Even here, I wanted to bring them. But because I have a very supporting wife. And the reason I always say supporting wife, supporting mother, because people say, how are you so fit? How are you so healthy? How are you don't go to the doctor? How you still have hair on your head? I mean, you have wonderful hair. It's because of you have supporting amazing wife,
Yes.
right? I think
Yes.
it's the wife.
Supporting
Do you
wives,
believe?
supporting children. Now the daughter takes of care of
Daughters.
the clinic.
So you have
Is,
two daughters.
yeah, I have two
I
daughters.
take lessons from you every day. I have one more friend who
Acha,
have
okay,
two
I did not know
daughters.
that. So I have two daughters. The elder one takes care of the clinic
Hmm.
here, Mumbai. Soon she's going to join me in Dubai. The second one is in second year. I have a very supportive wife. So all these things keep your lower back happy.
So basically, you have to be less greedy, more hardworking, enjoy life, take less stress, talk to the doctors if you're not feeling well,
Yeah.
love everybody around you, throw people away if they are not liking you, and don't try to impress anybody.
Yeah, and if being greedy is making you happy, okay.
Yeah, greedy means greedy to make my family wealthy, greedy to make my body better. That greed.
Yeah,
Because when you
that's an ambition.
that's
That's
an
an
ambition. So
ambition.
people usually take greed
Mm.
in a very wrong way. So
Yeah.
I tell Shanice I'm a very greedy person. So Shanice says, you're not a greedy person. I said, I'm a very greedy person. I say, because you are in my life. So I consider you me.
Uh,
If you're not in my life, I don't care.
I find Shanis to be more ambitious than you. You know, whenever I see you riding, I just imagine I am riding. So that's how I love to see your vlogs. And I usually don't miss a single one because I want to now. I really want to, but the responsibility of patience, and when we say that, okay, please don't get dependent on medicines. Whenever something happens, come to us. We'll explain you the cause first so that you can reverse your disease on your own, and if required, we'll add up medicine. uh, when we say this, it is a big responsibility, and whenever my patients need it, I have to be there. So that's the reason I'm now finding it difficult to take out some time out of my busy schedule.
But you always buy things. अरे निखिल, I saw that screen on your bike. कहाँ मिलेगी? अरे डॉक्टर ने राइडिंग. अरे टाइम आएगा तो राइड
All
करेंगे.
those things on
Everything you
your
buy.
bike are on my bike.
I know. So you have responsibilities of many people, many patients, many children. I have responsibilities of 3 humans in my life.
Yes.
But then we do enjoy.
Yes.
And the reason, thank you for pointing that out. When I ride, first I wanted to enjoy. I used to enjoy. But then many people I met, they are like, when we see your videos, I was like, we are riding.
Yeah.
So beach mein, I wanted to make a movie kind of a thing where the drone is flying, where the camera angle is there. But then I realized the beauty lies in simple things. I made it simple. And whenever I do things very simple, probably this videos is gonna be very, very simple. Very मन की बात अंदर से जो आ रही है, जो हमेशा अंदर रहती थी. Especially now we are going to a very lifestyle topic. वो I started doing it. Everybody comes to me and they say the same thing. And that is the reason I initially decided I'm a family man. What is the whole point of showing this? But then I have a lot of guys, because when I started, all those guys and boys who were 17 or 16, now they're 25, turning 26. So that time,
Yeah.
all the men who were 27, 28, now they are 34, 35.
Yeah.
So all those guys are shifting into responsibility now.
Yes.
So they're there thanks to you, because you warned us
Yeah.
about the future.
Oh, the future. Yes.
And that is the reason of this kind of videos. That is the reason I do a lot of gyan in my videos. Guys, please be safe. Don't do this.
Yeah.
And you calling me whenever I'm making those kind of reels. Nikhil, don't do that.
I swear. I mean, I type and then I think, should I? I said no. Okay, he's my hero, so I should
No, you're
say
right.
whatever.
You
Yeah.
know why I do it? I'll tell you why I do it. It's because a lot of people, see, we have a kid inside us, right? We always have that kid inside. Doesn't really matter you're 15 or you're 70, you have that kid inside us. And whenever I ride, I have that kid. I was like, bhai, aage dekho, piche dekho, everything is safe, and I'll do that move because that attracts that young boy. Okay, he's not just, some old guy riding a GSA. If you're 15, then I'm old.
मराठीत म्हण आहे पोरखेळ.
Poor
We
kid.
all want to have that पोरखेळ.
Yes. And then it attracts. And
Yeah.
because I remember now there are young boys and they say, my father also watch you. I say, father, and it's been going on since 7-8 years. So मुझे कभी समझा नहीं.
Yeah.
But when you came into my life and you started explaining me about life, about homeopathy, about being calm, composed, and one thing which really scared me, and I have to be proud of, anger can lead to a bigger diseases.
Yes.
And I realized, okay, I'm gonna not get angry. And how to not get angry is the biggest challenge in a man's life.
Yes.
Because so many things makes us angry.
Yeah.
गाड़ी नहीं शुरू हो रही, इसने काम नहीं किया, मॉम ने कुछ बोल दिया, डैड ने कुछ बोल दिया फॉर यंग पीपल, गर्लफ्रेंड छोड़ के चली गई फॉर नो रीजन, बीवी ने आज ठीक से बात नहीं की, बच्चे नहीं सुन रहे, स्क्रैच मार दिया, हाउ टू रिस्पॉन्ड,
These
having a meltdown. You cannot afford to have a meltdown in front of toddlers. You have to be like, Hari Om, bolo beta kya hua? Thap, Hari Om, bolo beta kya hua?
Yeah, so if you react, it is sting conflict, scent conflict that causes rhinitis and cold coughs. But if you're calmer, you don't get all these cough, colds, and this.
Mhm.
And your immunity goes down because of the stress. Naturally, the bacteria and viruses are going to come and attack you. Just to add to that, our Prime Minister has warned us that we are getting antibiotic resistant. We are popping in antibiotics for small, small petty matters, which should stop. You should go to a doctor whenever you need medicines. Unnecessary taking medicines. Our next epidemic is going to be the antibiotic resistance. Because if you keep on going like this, no medicine will work on our system. So that's one more scare which is coming up. That's the reason first you should find the cause of the disease. Then, if possible, take all these alternative steps or take homeopathy or Ayurveda and bring down your intensity of suffering. And then, if you feel that things are not right, you can go to the physician and take antibiotics under his prescription, not to go on the counter and demand medicines.
I think this has been going on since very, very long time. I think it started somewhere in Middle East. When I used to fly, I don't remember which destination, but somewhere from Qatar to go somewhere. I remember that flight we used to call a Panadol flight. Panadol, I don't know, it's popular in India because
it's
I
a
don't take
paracetamol.
paracetamol. It is a paracetamol. I don't take any medicines since very long. So we used to call that flight Panadol flight because everybody
Pop in
used to
Panadol.
pop. Khana ho gaya, Panadol. One Panadol, please. Panadol. Panadol Plus. Panadol Pro. There is Panadol Pro Max. Everything. And they used to, everybody, Panadol. If they don't, I think Panadol, Panadol. So we used to carry extra Panadol because you cannot give medicine. But we were told कि भाई देना पड़ेगा because they get anxious and they are carrying also. And I've seen that happening in India. My mother headache हो रहा है, दवाई खा ली, ये हो रहा है, डॉक्टर ने दवाई दवाई खाई. So I tell her, mom, you need to just sleep. Don't worry about the bank account. Relax. तू चुप बैठ, तुझे नहीं पता कितना प्रॉब्लम है. I said, but your health is important now. Throughout your life you have worked. Now you are in your 60s. Relax. Close your eyes. You have made enough money in your life. But she doesn't want to stop. It's that thing, I want to work, 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 and worry, 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 and then blood pressure goes up. I've come to Nasik. I have not informed my mother. After reaching, I called my mother and I said, Mom in Nasik. पता है what she said? She said, सुबह मुझे मैसेज आया, 9:30 एक टोल क्रॉस हुआ, मैं डर गई. मैंने बोला निक्कू तो सो रहा है,
गाड़ी
कोई लेके भाग गया, मुझे गैस हो गई. So I was messaging you.
See this mind?
My relation with my mother has never been this sweet.
Yes.
She listens to me. Whatever you say, I tell her, please don't take medicine, sleep more. She tries her level best.
Yeah.
She never listened to me throughout her life. And now she listens to me.
Pain is a warning and a friend. So you should not neglect this pain. Try to find out what happened before this pain started and you can solve it. One. Second, what has changed after this COVID is a small cold cough, which we used to go to our family physician or just let it heal on itself, we go to hospitals. And when you go to hospitals, we go with that mindset that we have cold, cough, and fever. These people admit you, and once you are admitted, they bombard a lot of tests and medicines on you, is what is again weakening us.
Okay.
So my dear friends, again, you should not panic. You should first consult your physician, take the necessary steps if required, and if he refers, go to the hospital. Don't go and lie down in the hospital on the first smallest sign of illness, because that COVID has changed the mindset. Any small disease, cough, cold also
COVID.
can be COVID or something grave, and you will die.
But you know what now happened, right? It started from London. कि लंदन में वेव आया है, everybody is falling sick. They say under the weather. And then Canada में, all of my friends who have children, they said my child is been sick since 1 month. स्कूल नहीं जा रहा, स्कूल नहीं जा रही, कोविड आया है. And then वो इंडिया में हुआ. इंडिया में किसी ने उसको कोविड नहीं बोला. इंडिया में like my daughter was suffering from cold from past 15 days. Now she's okay. And everybody was falling sick, even me. I don't fall sick. I do get cold, but एक दो दिन I was having cold for like 15 days. I said ये क्या हो गया? एंड आप न्यूज़ में क्या देखते हो? AQI अब आज तो AQI खराब हुई नहीं है, तो पहले से हो रही है. एंड नाउ वी हैव बिकम लिटिल कंफर्टेबल. आई वेयर बलकलावा, आई स्लीप इन अ AC रूम. पहले तो कैसे भी घूमते थे, पहले कुछ नहीं होता था. नाउ ऑल ऑफ अ सडन, why this year specifically is something wrong?
Yeah. So when I go to Bombay Clinic, every of my patient was coughing. Yeah. And those were especially people who are middle class and higher middle class who travel a lot. So naturally, a new variant of a virus or a COVID virus must have come, which these people are suffering. And because of the antibiotic resistance and the intake of too much of antihistaminics like cetirizine in this, we have developed resistance. And that's the reason we are this time overreacting, or we are suffering for a longer time, because we have become resistant. And that is what people are talking about. Our Prime Minister is also talking about that antibiotic resistance is the next epidemic coming in. So don't pop medicines. Find out and rest and do your home remedies and try to bring things to normal. Unnecessary popping medicines. So this will grow as your immunity goes more weaker and weaker, and the virus gets more stronger and stronger. That's the reason more recurrent cough, colds, and small things will keep coming in. So be careful.
Okay. So thank you so much, doctor, for your wonderful information, knowledge. I'm pretty sure whoever is watching, let be young, old, or whoever is watching, आज बहुत सीखा होगा उन्होंने. So
Thank
guys,
you.
you understand what doctor said? कि it's not just the apple which keeps the doctor away. It's a positive mindset.
Positive mind. This is what will come. So there will be many comments on the podcast that what has the skin to do with mind, what has the knee to do with this, what has the body to do with this. Just close your eyes. Imagine that you are roaming around in a garden full of lemons. Imagine that you are cutting those lemons and squeezing those tasty juice on your tongue. When you are just thinking and talking, you will get salivation in the mouth.
Correct.
So your thought, if can bring in salivation in your mouth, your thought can change many things in your body and start the or stimulate the gland to function unnecessary. So change the thought, your perception, keep it into control, be happy, not get stressed about it, and you will be disease free.
Thank you so much. Thank you for all the information. I hope it will change many lives.
Thank you. It was my pleasure. Thank you for having me on
Thank
your
you so much.
show and podcast.
Thank you. Thank you so very much guys for watching the first episode मन की बात with निखिल शर्मा. I'm pretty sure आपके बहुत सारे सवाल रहेंगे with डॉक्टर आशर, जो कि आप कमेंट सेक्शन में छोड़ सकते हो. आगे जाके हम जब भी डॉक्टर आशर के साथ पार्ट 2 करेंगे, उस पर डिस्कस करेंगे, या फिर रील भी बना सकते हैं इसके बारे में. For now, you can leave a like, comment your thoughts, and definitely subscribe. And please share with your family members and